I'm Michael Sweeney. I'm the Vice President of R&D at DEPAMed, and we have conducted a study in association with the Ingenix Corporation, I think they're called Optum now, looking at patients with managed care plans to see what percentage of patients who start on gabapentin and pregabalin actually reach an effective dose and have their pain adequately treated, and what percentage need to have other medications added. In particular, in view of all the issues currently surrounding opioid prescribing, what percentage need opioids and which ones do they use? So we had overall around about 2,000 patients, 935 on gabapentin, 706 on pregabalin, typical PHN patients, 60s, majority female, and they're about 2/3 to 3/4 commercial insurance and about 1/4 Medicare Part D. What's of note is that patients do not reach an effective dose. Even when they've had 3 or 4 prescriptions of gabapentin, they're still only at about 1,000 milligrams on average. FDA approved dose, as you know, is 1,800. Pregabalin, 3 or 4, they're getting a bit closer, they're reaching over 200, below the effective dose of 300. So what do patients do in that situation? They want alternative therapies. Now, as you can see, 57-58% switch their therapy on pregabalin, 37 on gabapentin, 37 on pregabalin, and 37 add. So if you don't switch, you usually add on gabapentin, and 30% on pregabalin. So what do they switch and add to? Largely they add or switch to opioids. There are some topicals, there are some antidepressants, but largely it's switched to opioids. And obviously the patient has been being treated for some time at this point and is looking for effective therapy. So the physician tends to choose more potent opioids. You can see tends to add hydrocodone or oxycodone in the case of gabapentin, similar in the case of pregabalin. 20% of the patients have hydrocodone added, 17% have oxycodone added or switched to. So we can see that gabapentin therapy and pregabalin therapy is not reaching effective doses in clinical practice, and physicians are needing to add a large number of potent opioids.